It's Denise Force or Larissa Force coming from Hempill. Today we're going to be talking about Heliobacter pylori, otherwise known as H. pylori. It was first cultured in the early 1980s. It appears as a curved rod or a short spiral. It's a pathogen, causes peptic ulcers, and it's suggested that persons with chronic infections are predisposed to gastric cancer. Heliobacter pylori is suggested to be the most common human bacterial infection known. It is a gram-negative bacterium. It takes residence within the stomach and or the duodenum. Its primary energy source is hydrogen. Our bodies use hydrogen and it mixes with chloride to produce HCl. When the H. pylori consumes the hydrogen, it causes a decrease in the amount of HCl that your body produces. However, if the bacterium colonizes within the area where your stomach joins the duodenum, then too much HCl can result in ulceration, peptic ulcers. The HCl protects our bodies from pathogenic invasions and is also extremely critical for digestion. If the HCl levels are low, it can also result in a B12 deficiency, which B12 is, really great for everything else. HCl also kills candida yeast and other unwanted microbes from spreading through the intestinal tract. In order for the H. pylori to thrive in the high acidity of the stomach, it releases urease, which is an enzyme that converts urea into carbon dioxide and ammonia. The ammonia then alkalizes the environment. It makes it more alkaline so that way the H. pylori can thrive. The alkaline environment encourages overgrowth of other pathogens. The increased levels of ammonia could cause symptoms such as restlessness, headaches, nausea, seizures, encephalitis, confusion. H. pylori is the only known bacteria that has the ability to survive the highly acidic environment of the stomach. There's much debate over whether or not H. pylori is actually a normal part of the digestive system, or if it is in fact a foreign bacteria that should be eradicated as soon as possibly detected. The flagella gives the bacteria motility and enables the bacteria to grow under the mucosal membrane. Its lipopolysaccharides and membrane proteins adhere to host cell receptors. And again, the urease enzyme is used to combat the acidic environment of the stomach by producing ammonia. Some of the signs and symptoms of an H. pylori infection include, but are not limited to, abdominal pain with burning or gnawing sensation. Its pain is often made worse within an empty stomach. Nighttime pain is common. Poor appetite, weight loss, heartburn, indigestion, belching, nausea, vomiting. Blood in your stool can cause dark stools. It also can make you feel like you're full after eating. 50% of the world's population carry this bacterium, but it's more common in the developing countries and the elderly rather than in Western countries. Among the United States population, 20 to 30% of persons are infected with this disease or bacteria. The H. pylori exerts toxins that can lead to decreased levels of vitamin C and impede the absorption of iron. The immune system is unable to kill off this bacterium due to the fact that it adheres itself below the mucosal lining, therefore it is able to survive. It takes on different shapes due to its ability to form biofilms. When exposed, usually, like we talked about, it's usually a spiral rod, but when exposed to adverse environmental threats, it can change to a coccoid form, which serves as a protection mechanism. More than 80% of persons infected remain asymptomatic, never experiencing any symptoms at all whatsoever. Some experts believe that the exchange of this bacteria occurs through saliva and fecal contamination. I worked for a ear, nose, and throat doctor one time, and we saw a lot of cases of H. pylori, and he said that mainly in this country, it stems from cooks in restaurants not washing their hands when they use the restroom. Then they handle your food, you eat the food, you get H. pylori. The next thing you know, you're in the doctor's office complaining of GERD, heartburn, indigestion, etc., etc. once this bacteria has entered the body, it can and will remain in your body until it has been treated. Other symptoms can include anxiety, coughing, joint muscle pain, chronic fatigue, brain fog with impaired cognitive functioning, and the ability to focus and concentrate. There are several tests involved in diagnosing H. pylori. You have a blood test, you have a stool test. The most common test I've seen was the endoscope with the stomach biopsy, a breath test, which some experts say that H. pylori is connected to bad breath. Who'd have thought? As with any testing of microbes, false negatives can occur, and if the symptoms are present, false negatives occur. Most physicians will either have it retested, or they'll just go ahead and treat the disease anyways. It doesn't hurt, you know. Treatment's usually accomplished through a combination of medications. They have to do a culture and sensitivity to find out what strain this bacteria is. Therefore, we know exactly which antibiotic that will treat it. Once they do that, they usually also use a proton pump inhibitor and an H2, which is an acid reducer, which stops the process that pumps acids into the stomach. Some antibiotics that they use is amoxicillin, clarithromycin. There's several others that just aren't near as effective, but those are your main two that you would see most often. Since the H. pylori's favorite source of energy is hydrogen, any type of foods that result in excess hydrogen production, such as sugars, starches, grains, carbons, fibers, fruits, those can exacerbate the symptoms and make it to where you don't even know that you have it. There are some natural remedies include, but are not limited to, lactic acid, probiotics, vitamin C, berberine, extra virgin olive oil, colostrum, zinc, lactoferrin, turmeric, cinnamon, garlic, broccoli sprouts, and supplements that contain an active ingredient called sulforaphane. Frequently, H. pylori has developed resistance to many of these substances before treatment has even been thoroughly effective. And it is remarkably difficult to eliminate at that point completely. Any types of food that feed microbes and impair gastric integrity should be completely avoided when dealing with H. pylori. Sodas, things that are very acidic, anything that can mess with the gut, with your stomach, tomatoes, etc. Some people have found that a low-carb paleo diet helps them dramatically. As always, proper hand hygiene when handling food and beverages is a good aid in preventing transmission of the bacterium. And anyone that suffers from chronic gastrointestinal symptoms possibly associated with H. pylori should be tested, treated completely, full course of therapy. This not only maximizes the potential for a cure, but it also helps to prevent exposure to any family members that are near and close within vicinity. So intake such as cauliflower, cabbage, broccoli, it also aids in the prevention of the disease as well. In order to improve living conditions in developing countries, we need to, vote in better policies, within our government to help those developing countries, get where they need to be, set up FDAs and this and that. Vaccines have also been developed and are in the early stages of clinical trials to prevent Helicobacter pylori infections. So that's all I've got for you, but hope you enjoyed it. Thanks.